The Aspen Medical staff were on board the Ruby Princess cruise ship that was docked south of Sydney at Port Kembla. They were conducting screening and testing on the crew members on board that ship. Now, the vessel left Australian waters on the 23rd of April. By the 25th of April, 2 Aspen staffers were working at the Anglicare Newmarch aged care facility. The virus-stricken nursing home has now recorded 16 COVID-19 deaths. The New South Wales Chief Health Officer, Dr. Kerry, Chant, says there are no issues with the procedure.
Healthcare workers wear PPE and are trained, and if there is no breach in that PPE, they are not required. If every time a healthcare worker cared for a patient with COVID and then was required to take 14 days, we wouldn't have healthcare workers to care for patients. We have faith that wearing PPE appropriately protects the healthcare workers. We have screening in place for healthcare workers in our facilities, and we have messaged strongly about minimal symptoms get tested.
The government has been working in partnership with Anglicare to try and figure out exactly how the outbreak at Newmarch started. Initially, they thought it was an aged care staffer who worked 5 consecutive days at the facility while being infected and showing just mild symptoms. But last week it was raised there could actually be multiple sources for the initial outbreak. Now, authorities are confident that their initial diagnosis of the situation was correct.
I can announce that the results of that testing came back yesterday evening, and it confirmed that a person that we were looking at who was a resident in that facility has no evidence that they had COVID. So therefore that line of inquiry has been closed, and at the moment the earliest introduction into the facility is the original aged care worker.
Here in New South Wales, in the past 24 hours, we have recorded 9 new confirmed cases of coronavirus from 6,899 tests. 13 people are in ICU and 9 of those are in ventilators.